Hey parents, Dr. Garrett here from Foundation Chiropractic. And today I want to talk about torticollis, which is this. It's contracture on one side of your child's neck muscles that are causing their head to tilt to one side. Which can cause obvious just pain and discomfort, right? But also decrease range of motion and decrease movement of the muscles of the spine, which we're going to talk about later how that's huge for pediatric growth and development. A lot of times this torticollis can be caused from in utero constraint, right? The baby maybe wasn't in the ideal position throughout pregnancy. Maybe birth was either really long, and traumatic and sustained, or maybe there's an intervention needed. Baby just wasn't, progressing. Cord was wrapped, so there's like maybe a C-section or forceps delivered. There's nothing wrong with it. We have to get baby out safely. It's not what I'm saying. But those can be very traumatic to the upper neck of the baby, which can cause misalignments in their spine and in asymmetric muscle tone within their neck, causing contracture on one side and that head tilt to the one side. And this is really important because if you imagine when you're born, those first 3 to 5 years of your life, really those first 6 months to a year, but really anywhere between 0 and 5, your brain and your body's really growing and developing. And if your body's growing and developing out of this window, you're not perceiving your environment appropriately. We need to grow and develop perceiving our environment out of this window. Because if your head's tilted to this side, guess what? Your eyes have to compensate, your vestibular system has to compensate. Everything has to compensate, leading to not ideal growth and development of all those systems. I'm talking the eyes, the vestibular system, the postural system, the brain, and the body overall. So it's really important, if your child has a head tilt, whether they be an infant and they had a traumatic birth and you notice a head tilt always to one side, or even if they're older and they have a head tilt constantly to one side, they could still have that contracture and that torticollis. It's really important to get them checked by a pediatric chiropractor, get their head on straight so they can start perceiving their environment appropriately and start growing and developing appropriately. This can lead to a lot of things later on down the road, like reading issues, coordination issues, balance issues, all sorts of stuff, because you're not perceiving your world the way that you're supposed to. And it can also prevent an asymmetric tonic neck reflex, which if you follow our office, we talk a lot about primitive reflexes and how they're important for the first 6 months to a year of your life, but then they should go away. Well, if you have this torticollis, it can prevent an appropriate asymmetric tonic neck reflex, which is huge at building cross-crawl patterns within your brain and in your nervous system, basically body awareness type stuff, eye awareness, eye tracking type stuff, which if not developing appropriately can, like I said, lead to these balance and coordination issues later on, can lead to reading issues and stuff later on. So the asymmetric tonic neck reflex needs to be present, and if they have that contracture, they're not going to have the appropriate asymmetric tonic neck reflex they need to truly grow and develop their nervous system, grow and develop their brain, grow and develop their postural system, their vestibular system, and their eyes, so they can be coordinated and they can have success in school later on down the road. So if you have any questions or comments, it's really crucial on these kids. Like I said, if you notice your child always like this, bring them into our office. We'll do an assessment to see about that contraction, that torticollis, see if we can't help. Adjustments in this office are very safe, very gentle, very effective, and it's important to start restoring that balance so they can start perceiving here. We restore motion at that joint because movement really drives the brain, so you want that symmetric tone, and we can really start getting your child on the health to true health and happiness and appropriate growth and development. So if you have questions or comments, please don't hesitate to reach out. We're here to help in any way that we can. Comment, call, message us, whatever it takes. Hope you found this information valuable, and I look forward to hearing from you. Thanks a lot.